And speaking of technology, have you considered at all the use of things like artificial intelligence and machine learning to maybe analyze some of the data from your work and even past clinical work? Because some of the conversations that I've heard is, really around machine learning being used to analyze past clinical trials to see if there are some insights that we can pick up on, and then things like that. So has that conversation come up, or what are your thoughts on that?
I think it's an important and emerging field as to how we can use artificial intelligence to analyze data that we have, and especially combine different levels of data more clearly. But I think the uncertainties that are the biggest is at the moment, how can you make decisions based on that really? And where does a human have to review the data still? Where will it be really reliable enough so that, there is no hallucination in a system somewhere? I think what I work very closely with is colleagues in imaging, and of course in because we're so research active in the use of whole body MRI in myeloma. My radiology colleagues, of course, are involved in their day-to-day research in tools that in the future should hopefully help radiologists diagnose myeloma, for example, on a whole body MRI scan much quicker. I think at the moment there is more than several thousand images when you do a whole body MRI that a radiologist needs to manually flip through. Effectively, that's, their brains have been over time just getting so used to it, they can do that in an astounding time. But to get there, you need many, many years of training, of course. And I think in image recognition, we might see, one of the biggest, advances over the coming years, really, in how humans can be supported by pattern recognition tools. And then I think from there, we will see next steps, hopefully, over the years after.
Mhm. What are the main points in your talk that you hope to see applied soonest in day-to-day practice?
I think the message, of course, in that we do need to, and patients with myeloma do deserve more diagnostics, is now getting louder. And I'm very glad that I can present, the new genomic classification for high-risk disease. It's such a community effort that will really strengthen the case for all patients. I do think that the data that we have generated with an academic trial like the Optimum trial in better treatment is really striking. It is different from country to country as to how much people will be able to access this type of treatment, but it's been intentionally designed so that it is actually all only using licensed drugs. So I think in some communities, I hope this can kick off a advocacy process where patients and physicians can jointly convince healthcare systems to really make personalized treatment for high-risk patients accessible.
Mm, that's great. Thank you so much for joining us on MD Newsline. It's been a pleasure talking to you.
Thank you very much.